All right, now we're going to be jumping into the health check with Dr. Baggett. I've been trying to reach him, but I guess the network is fighting. I really hope he's online. Good morning, Dr. B.
Good morning, Zoo. How are you?
I'm so good. I've been trying to reach you. I don't know if you are, in the Okavango or somewhere far away.
I wish.
Definitely. So, yes, also before we start, Dr. B, I've been seeing you get a lot of shout-outs on social media talking about people, cutting off sugars and eating healthy lifestyles. So I'm so happy that you're getting the recognition. It's really great to see. Yes.
Well, but Jude, I think that the only thing I'd say, Zoo, is we've spread so much information out there. Now it's not about education. It's about implementation.
Yes.
They've got to implement what they know, because people know a lot, but they just don't want to do it. We've talked about the word cognitive dissonance, where you know what you should be doing, but there's always an excuse not to do it.
No, definitely. But I can see, like I said, 3 people on social media have started following you, and I saw somebody on Instagram posting about the lifestyle change that they've made, and it's because of them listening to your rules and regulations. So that's a good one.
Well, that's very kind, but they're not my rules. They're nature's rules. And
I know.
So today we're going to be continuing our talk on chest issues, and the big topic today is asthma, which is a very common condition, and it affects many people, young and old, and can occur at any age. People think that it's only a childhood problem, but it can certainly occur later in age, and we'll talk about why. And basically, it's a condition, and I know you're one of those that's affected. It's a condition which in where your airways narrow and swell, maybe because of extra mucus, and this can make breathing difficult and trigger the classic sort of whistling, wheezing sound, coughing, especially when you breathe out, and shortness of breath. And in some people it's a nuisance, in some people it can be life-threatening. So it's a really important subject to talk about for those out there that are listening, because in this day and age, in 2022, we should not be having guests from asthma. And one of the reasons why is many people take it lightly because they think, it's just a bit of allergy. But, it can actually result in life-threatening issues, where you just keep sitting at home thinking it's going to get better, and eventually your airways freeze. And by the time you get to hospital, we literally have to try and force the air down by a ventilator, and sometimes it doesn't work. And it's always tragic, particularly the younger the patient, that we lose them because they've been sitting at home with this shortness of breath and cough. And some people, I just want to say at the outset that the classic symptoms, and you may have them, is that of wheezing. But many people actually just get a little bit of shortness of breath, a bit of tightness in the chest, and sometimes a cough at night. And that's all there is. That signifies that you're asthmatic. And you keep taking flu mixtures and all sorts of things, and it doesn't work. And the reason is because, what you have is actually asthma.
Definitely. And seeing as, like you're saying, people that sit around with the asthma and it gets too worse, how does one prevent symptoms from worsening?
Well, the common triggers for asthma, Zoo, are usually the things, unfortunately, that we come across on a day-to-day basis, because people often do allergy tests, and sometimes they may not be a good idea, because the allergy test will say that, you're allergic to dust mite and to pollen and to, cockroaches and pets and mold and cleaning and disinfection. And the trouble is, we live in an environment where these are always around. Botswana has a dusty climate in the summer. There's lots of dust, there's lots of pollen, there's lots of mopani trees. We have pests around, we have pets around, we have mold around, so difficult to know what to do. But so the first thing is of course, know, for example, when it's spring or the mopani trees are out, or the flowers out, and you start sneezing and you start getting tight, that there's a relationship. Some people, it may be flu. It may be tobacco smoke. It may be sometimes people's perfume tends to tighten up the chest, and you will know with time that these are certain triggers. And then you get that whistling sound when breathing, a tight chest, almost like a band is tightening, and coughing. So the early signs of asthma are the diagnosis: frequent coughing, especially at night, losing your breath easily, getting tired, especially when exercising, wheezing, and I guess grouchy and moody because your oxygen levels are dropping. Did you have any of those?
Well, I've never really had severe asthma. It's always gone on and off, but I know my siblings. My brother had very, very severe asthma when he was the one after me. He had it from 0 to 3 months. And then my youngest brother actually suffered from pneumonia, and he actually uses the Seretide spray because his asthma was really bad. But nowadays he's really fit. Even when he got COVID, he was perfectly fine. There's nothing that he suffered through, but he was the one that actually was a hazardous child.
Well, you mentioned a couple of interesting things there, which people need to understand that asthma often runs in families, and it can. It's an allergic condition. So sometimes in some children, the asthma the allergy may present with rashes on the body and eczema and itchiness. Others get a little bit of rhinitis and a runny nose, and others get the chest symptoms. So it does tend to run in families, and so be aware. If mum or dad have it, or brother or sister have it, chances are you may also have it, so you need to test. Somebody's asked here, since you mentioned COVID, Naka, how can I tell asthma from COVID? Well, this keeps coming back, and we are seeing a rapid rise in COVID in our country, so be careful. Well, COVID-19 generally causes cough without a wheeze, whereas asthma is an audible cough and wheeze. COVID causes shortness of breath, as does asthma. COVID causes nasal congestion, whereas asthma causes chest tightness. COVID causes nausea, vomiting, and sometimes a running stomach, but asthma doesn't do any of those things. So that's the issue. And remember, COVID often causes a loss of smell, so that's important. You also mentioned the use of a medicine called Serotype. Serotype is a steroid inhaler, and people are really afraid of the word steroid. And the steroid inhalers, or some people call them sprays, have actually been a godsend to patients with asthma, and people really need to use them appropriately and regularly, because they are the cornerstone of the management of asthma and can actually save your life and also prevent you from not engaging in exercise. Exactly. And so don't be afraid to use the inhaler. Make sure you're using the inhaler properly. People who have not been taught simply spray this stuff and it gets stuck in the back of the throat. You need to know how to breathe in that inhaler, the steroid inhaler. There are also ones that you can use for quick fixes, and people know them as Ventolin or salbutamol. And as you've said, many people actually grow out of it, like you do. And it's important that it often is not a lifelong condition. Somebody's asked here, what foods make asthma worse? Well, some of the most common foods are things like gluten, which is from wheat and cereal products, eggs, milk, peanuts, soya. So you'll know which ones trigger them, particularly if you have children and your child starts wheezing after you give them a glass of milk or something like that. So that's really important. Somebody's asked, can Vicks help with asthma? The answer is no. Vicks Vapor Rub is a topical medicine designed to relieve cough in case you have flu and colds, like we talked about last week. And it's safe for kids to use, but it will not relieve your asthma, and you need to use an inhaler, so that's important. Somebody's asked what natural treatments are available to assist. Well, the most important thing is foods that can help asthma are things like almonds, hazelnuts, raw seeds are good sources of vitamin E, and these things can help your wheeze. Certain teas can help, Zoo, you like these things. Herbal teas can help relieve symptoms. And research suggests that ginger tea, green tea,
my favorite,
eucalyptus tea, fennel tea, licorice tea, all these reduce inflammation in your body. And in the old days, we actually used to light a stick of licorice and actually blow it down into the mouth of a baby, and it'll actually release the muscle tension. So these are old remedies that they do work, and something that people need to know about in terms of asthma. Somebody's asked, does asthma go away? Yes, it can, but if it's not treated on a regular basis, what happens is the lungs freeze up, and you can get a chronic condition where you have eventually bronchitis, where you're continually coughing all the time because so that's really important. Somebody's asked a really strange question here, and that is Coke good for asthma?
Like Coca-Cola, the drink, what? You're Dr. B.
I think, I don't know what he's getting at, or she's getting at, but we do know that caffeine is a weak bronchodilator. It opens up the lungs, and there is some caffeine in Coke, but that's absolutely no reason to drink Coke, because that stuff is really toxic stuff. And we've talked about that until the cows come home. And somebody's asked, can asthma be caused by stress? Yes. Indeed, it can. Strong emotions and stress are well-known causes of triggers of asthma. And there's evidence between anxiety, depression, and asthma. And sometimes you may wonder why it's got worse, etc., etc. So these things are important. And one more question here. Somebody's asked, do inhalers damage lungs? The answer is absolutely not. Use your inhaler carefully and consistently if you're a regular asthmatic. If the steroid quantity is high, the doctor will advise you how frequently you take it. So that's important. Somebody's asked here, is steam good for asthma? Many people find asthma gets better with warm, soothing air. So a steam bath like a sauna or a shower at home can actually help clear the mucus, so that's important. One more question here. Does asthma damage the heart? Well, that's my area. Well, indeed it does. If your lungs are under continual tension, the lungs can't deliver the oxygen to the heart, and the heart that is drawing the oxygen from the lungs gets under a lot of tension. You develop a condition called pulmonary hypertension. So in the long term, it can actually damage your heart. So that's important to understand.
All right. Well, Dr. B, there was one thing that I wanted to ask, and we went like the other way, but it was really important. I don't know what I'm going to do now. I'm suffering. But yes, if you want to shut it down, definitely you can. And then if you do want to let them know what we're talking about, can I ask? Yes, it's about children. The trauma in their asthma cases, like you said, it connects with depression and all those things. Have you ever seen in children's cases where you can actually sit with them and see that the trauma is making their asthma worse?
Oh, absolutely.
Okay.
You can actually, and clinical psychologists are able to determine certain situations that trigger the stress. A child that's been locked away in a cupboard, a child that has been abused, and just the thought of it begins to trigger what's called a sympathetic response, which means the adrenaline goes up and it causes tightening of the airways, and they go into a wheeze and they get short of breath, just like a panic attack as well. So very much so we've seen that, and we've even seen, although it's not the source of today's topic, we've seen that in children with diabetes, the diabetes gets worse when they're traumatized, because the trauma and the adrenaline raises the steroids, and steroids raise the sugar. So sometimes the sugar may not come down because something is triggering the trauma in that child, and the sugar begins to fluctuate. So there's lots of things that we now understand stress does besides cause anxiety.
All right. Well, Dr. B, I'm very, very happy about what the information you've shared with us today. What are we talking about next week?
Tomorrow. Next week, we're going to finalize our topic. We're going to talk about allergies. What are allergies? Why do they occur? That itchy, runny, sneezy, rashy, hivey stuff we're going to talk about, because it's something that's quite common across children of all ages. What causes allergy, how to treat it, and can it actually become life-threatening? So we'll talk about that next week.
All right. Dr. B, have a great Sunday. It was great having you today.